quickly trot through some ideas for communication. I hope that everybody's going to leave North London today fired up with energy and enthusiasm to go back to your hospitals and really drive change for patient good. But we all know what happens, which is that one gets dragged back into the normal day-to-day living, and it can be really, really hard to find time for improvement. So one needs to communicate effectively and build a team in order to do that. So we're going to spend 5 minutes, I think, talking about improvement, communication for improvement. In your packs, we've produced a few infographics. This is one of them, comms for comms, to try and make it easy to remember. So the first of C's is being collaborative. So the idea is that the data that you work so hard to collect through PQIP and your patients work so hard to provide to us is a shared resource for the whole team, for the whole hospital. And so presenting it as a shared resource and an opportunity for improvement is really, really critical to success. Now, one of the opportunities that we have with quality improvement in general and with PQIP specifically is to support more junior members of our team, more early career colleagues, whether they're nurses or doctors or other allied health professionals, to take a leadership role in delivering quality improvement. And that's a kind of peloton style of leadership, where you don't have to have the head of department or the professor doing all of the figurehead work. It should be shared amongst the team, and more junior colleagues should be given an opportunity to lead. But they need support in order to be able to do that. And if we put our more junior colleagues up in front of a room full of very senior surgeons and anaesthetists, they may have a very hard time. So one thing to do is be collaborative about the way that we present the data, be collaborative about the way that we drive improvement projects, but support early career colleagues in their improvement efforts. The second is to try and be objective. So the report is full of data. Aaron's just explained to you how you can unlock even more data. There isn't enough room in a reasonable sized report to put in everything that we collect on a yearly basis. So being objective about the way that you present the improvement opportunities is really important, because you have objective information there to present. Let the data speak for themselves, even if you're particularly irritated about the fact that everything that you've tried to do to improve preoperative anemia or diabetes management rates hasn't worked. Try and present it in an objective and unemotional way in order to try and gain the collaboration of your colleagues and the engagement of your colleagues. And then talk about your own ideas later when presenting the plans for how you might make progress. The third thing is thinking about multiple media. So every single person in this room, I would wager, has got a smartphone and has got internet access. And we regularly, in every aspect of our working and home lives, use multiple forms of communication. And there is the real opportunity to do that with PQIP as well. So whether it's mobile apps, whether it's face-to-face presentations like this, whether it's departmental emails, why not figure it into the team brief once in a while at the beginning of an operating list? Just bring along an extract of data that you think is relevant to the team that you're working with and talk to them about it, and just get that conversation going. And that's actually really, really important for some of the members of staff who, again, contribute to patient outcomes but are otherwise rather left out in the cold when it comes to things like this, such as, for example, the operating theatre staff, the ODPs, the theatre nurses, and so on. They would actually be really interested and would really care to hear these data, and it would be a really, really good way of building your team in order to affect improvement. Try to be mindful. I've had this problem personally, where one can present some data and people get upset because it's not as good as they hoped it would be. We all think that we're the best, and sometimes when the data tell you that it might be slightly different to that, then that can be a real challenge. I think that's particularly a challenge for surgical colleagues who are very, very much under the microscope in terms of the way that their outcomes are examined through other national audits, not this one. But I think that when presented with results that perhaps don't look as good as they hoped, that can be really difficult. And it can breed defensiveness. So the data are wrong, our patients are more difficult, there's some problem or other that explains the data in a way that means that we don't have to acknowledge that it is a real issue. And we're all capable of that. If we're challenged. So trying to be mindful about the way that the data are presented so that we try and gain people's trust and bring them on board is probably the best way to go. And then finally, have a support plan in place, because presenting the information is fine. You've all got individualised reports for your hospitals, and there are plenty of ways of accessing data regularly in order to keep your teams updated. But having a support plan in place is really important. And that, again, is about building your team, identifying your improvement priorities. You know, in most domains, the data that we collect in PQIP, even though it's hugely comprehensive and an enormous amount of work for all of you guys, it is actually really only the beginning. So if you're looking at good diabetes management, just knowing whether or not you measure HbA1c is only the first step in that process. And so you need to have a support plan in place to look in more depth at what's going on really, and then draft a plan and present it. And ideally engaging everybody in the multidisciplinary team, so not just your anaesthetist colleagues if you're an anaesthetist, or your surgical colleagues if you're a surgeon. The managers, really critically important. Using PQIP to build your business cases, we've already heard about, is a real opportunity. And ideally, patients. Telling patients in the hospital about the fact that you're engaged in this program and that patients are providing their data in order to help improve future patients' outcomes is really important. And always, cake can help. Thanks very much.